Vitamin D is a fat-soluble vitamin that plays a vital role in maintaining overall health and well-being. It is unique because our bodies can produce it when exposed to sunlight, and it is also found in certain foods and supplements. Vitamin D exists in two main forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Sources of vitamin D: sunlight. When your skin is exposed to ultraviolet B, UVB rays from sunlight, a cholesterol derivative in your skin is converted into vitamin D3. The amount of vitamin D produced depends on factors such as the time of day, season, geographic location, skin pigmentation, and sunscreen use. Generally, spending 10-30 minutes in the sun a few times a week on the face, arms, and legs is sufficient for most individuals. Food sources. While it can be challenging to obtain sufficient vitamin D from diet alone, some foods naturally contain small amounts of vitamin D. Fatty fish like salmon, mackerel, and sardines, as well as fish liver oils, are good sources. Additionally, small amounts of vitamin D can be found in beef liver, egg yolks, and fortified foods like milk, orange juice, and breakfast cereals. Functions of vitamin D: calcium absorption. One of the primary functions of vitamin D is to promote the absorption of calcium from the digestive tract. It helps regulate calcium and phosphorus levels in the blood, which are essential for maintaining strong bones and teeth. Bone health. Vitamin D works in conjunction with calcium to support bone health and prevent conditions like rickets in children and osteomalacia in adults. It helps in the mineralization and remodeling of bones. Immune function. Vitamin D also plays a role in modulating the immune system, supporting a healthy immune response and potentially reducing the risk of certain autoimmune diseases. Muscle function. Adequate vitamin D levels are associated with improved muscle strength and function, which is important for overall physical performance and reducing the risk of falls in older adults. Vitamin D deficiency. Insufficient levels of vitamin D can lead to a deficiency, which can result in various health issues. Common risk factors for deficiency include limited sun exposure, having dark skin, living in northern latitudes, being elderly, or having certain medical conditions that impair vitamin D absorption. Symptoms of deficiency may include muscle weakness, bone pain, increased susceptibility to infections, and in severe cases, conditions like rickets in children or osteoporosis in adults. To determine vitamin D levels and guide supplementation, a blood test measuring 25-hydroxyvitamin D, 25-OHD, is typically performed. Supplementation with vitamin D3 or increased sunlight exposure, along with dietary changes, may be recommended by healthcare professionals to address deficiencies. The appropriate dosage depends on individual factors, and it is advisable to consult with a healthcare provider to determine the most suitable approach for optimizing vitamin D levels.